Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of August 7th, 2023. After a brief COVID status update, I will talk about innovations on the horizon with COVID. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. So as I've been reviewing, we are at the point in the pandemic where we have to rely on multiple different indicators to get a sense of where we are. The best indicators at this point seem to be wastewater, percent positivity, and emergency department visits and hospitalization, kind of in that order from early to late indicators. So I'll walk through each of these. Taking a look at wastewater, this graph is showing the percentage of sites in the United States that have increases, that's in the orange, and large increases, that is in the red. The yellow is stable, and the blues indicate decreases. The black line tells you how many sites are reporting, and the shaded area is telling us that the data is still incomplete there and still being updated. So the number of sites will likely go up as that historical data gets added. But as it stands, these data are through July 31st, again, with that caveat that the last 2 weeks are not complete. So unfortunately, this data is pretty much not complete going back 3 weeks, but still you can see here that since early June, we've just kind of been going up in terms of that red and orange part of the graph. So we have increases, the orange and the red, which are on the rise, and then the percentage of sites that are decreasing, which are in the blues. You can see that blue area is kind of shrinking as you look over to the right there. So the blues are in the decline. So basically, wastewater concentration of SARS-CoV-2 is going up. If you're interested in how your area is doing, you can take a look at the wastewater map, which I have linked in the post. Now, taking a look at percent positivity, we can see that this curve is going pretty sharply up. And this is, again, nationwide data. And we're now seeing a test positivity rate of 8.9%. It's worth noting that this is only based on 30,000 to 40,000 tests for the whole country. And by way of comparison, at the height of the Omicron surge, we were looking at 990,000 tests being done in 1 week. Now we're down to 30,000 to 40,000 in 1 week. And really, these numbers dropped to this level around May or June of this year after the emergency declaration ended and testing became more scarce. So in my opinion, we really can't compare the test percent positivity to times that are too far back in the past. In fact, I really think that this is mostly a forward-looking metric that will help give us an indication of the direction we're heading. And we probably shouldn't look back too far before May 2023 or so to try to compare the actual value, because I think, again, that's somewhere around the time when testing access and testing behavior changed. So barring any dramatic changes in testing behavior in the future, I'd say this is going to be a good indicator that will be useful as far as the direction or the trend we are going. And this data shown here is all the way through July 29th, also with the last 2 weeks being incomplete. And now taking a look at emergency department visits, you can see this is the percentage of all emergency department visits with diagnosed COVID-19 in the United States. And we can see that this upslope is just continuing. And these data are actually the most updated out of all. This graph reflects a 7-day moving average as of August 4th. So when we see emergency department visits start to plateau or drop off, that will give us some reassurance. But for now, we are just headed up. So we have increases being demonstrated in our wastewater, our percent positivity, and our emergency department visits. And all of this certainly translates into more people getting sick, more people missing school, missing work, and some percentage of people ending up with long COVID or post-COVID events. But when we'll get really concerned is if we see the severe outcomes increasing, which are hospitalization and death following these other indicators. And of course, some of that remains to be seen just because we haven't hit a peak or plateau to make all of the correlations to the three indicators that I mentioned. But second of all, because hospitalization and death increase much later than wastewater cases and even emergency room visits, those are lagging indicators. But still, nonetheless, we can see that here we are seeing already increases in hospitalization, unfortunately. And this is what gives us concern that we really are not in a place where we can say that cases don't correlate to severe outcomes. They still do. And so even with some level of immunity in the population, we are still seeing that increasing cases is translating into increasing hospitalizations. What we see here is the week ending July 29th, over 9,000 hospitalizations. And we were down to in the 6,000s for much of June and July. So this uptick is certainly significant. And we can see here that the uptick represents a 12.5% increase just in the most recent week. And it was about a 12% increase the week before. So a very unwelcome trend at this time. Fortunately, deaths appear to be stable right now, but once again, we truly don't expect to see an increase in deaths until several weeks after the increase in hospitalizations. So we can certainly be hopeful that with improvements in treatment that we have, we'll see better survival. But for folks who end up hospitalized, we know they already missed that window for outpatient treatment, which is really when we want to intervene. So by definition, these folks are already in a serious situation. So by all the metrics that we're now having to look at to determine whether we're having a wave or a surge or an uptick or a spike or whatever terminology we're going to be using, all of those indicators are heading up at this time. And I wanted to share that our public health officer for Santa Clara County came out to make a statement about the situation. She said, referring to her and her colleagues, and I quote, "Every single one of us masks every day because we look at the data." And I'll point out that this picture with the surgical mask was from a few years ago. But she also went on to talk about how she herself got COVID this past February, saying that she removed her mask for a social event and 48 hours later, she was sick. And another quote, "I thought I needed to take the risk, so I did so knowingly, and I was miserable." She said that masks work and that she won't be chancing it again. I linked the article in the post because it has some great local data and more from Santa Clara County's fearless public health leader, Dr. Sarah Cody, for those who are interested. And now we'll take a look at variant proportions. We can see that we are still dealing with all XBB subvariants of Omicron. And remember, EG.5 is really XBB.1.9.2.5. So it is still an XBB. But we do see here that EG.5 is increasing at a pretty rapid pace. And even though it's not so different from its XBB siblings, I guess, it is still bringing some concern. This information is coming out of Professor Younglan Cow's lab, and I've shared his findings on emerging variants many times in the briefing previously. And the concern is due to one of the mutations on EG5. And the mutation alone doesn't seem to be the concern. It's that when it gets together with another mutation, it binds better to our cells. And there are variants with this combination of mutations that helps SARS-CoV-2 bind better to our cells. And Brazil at this time seems to be hosting increases in this combination of mutations. So we'll be keeping an eye out for what happens next in Brazil. And in the meantime, United States vaccine manufacturers are busy developing boosters against XBB.1.5. And our new CDC director, Dr. Cohen, is now saying that this booster, the monovalent booster against XBB.1.5, may not be available until October. So that is pushed back from what we were told previously, which was September. And it's really concerning that this is just taking so long when we were all told early on that the mRNA platform is ideal because of the ease of being able to update for new strains, that this is a process that could be done in a few months. But here we are now, once again, with our old strain being pretty far in the rearview mirror at this point before the new one is decided upon, let alone produced. And so up until now, our strategy has been to chase after SARS-CoV-2. And as we've seen, SARS-CoV-2 has remained ahead. And you'll remember that the Biden administration committed $5 billion to Project NextGen, which promised to work on innovative treatments that could hopefully change the nature of our ongoing relationship with SARS-CoV-2. And the news coming out of Project NextGen has been slow, to say the least. It just does not seem to have the type of political and financial backing that Operation Warp Speed had. But at the same time, it's very clear that SARS-CoV-2 is not done with us. So we can't be done dealing with it. And even though we might not have the sense of urgency that we had at the time of Operation Warp Speed, there really is a lot of work yet to be done. And so after what probably hasn't been such great news so far in this briefing, I did want to share some possibly hopeful information about some innovations in COVID. So first, I want to talk about this article that was published in Science Advances. And so as I've said, up until now, SARS-CoV-2 has kind of stayed ahead of us, is really because new variants keep emerging that get around our prior immunity from either vaccine or infection or both. Our antibodies from earlier strains just are not neutralizing the new strains. So basically our antibodies, regardless of if it's from vaccine or infection or both, are too specific or just not broad enough to neutralize new SARS-CoV-2 variants, let alone any other sarbecoviruses, which is kind of the group of viruses that include SARS-CoV-2 and SARS-1, and conceivably in future, SARS-3. So in this study, they isolated antibodies from a patient who was previously infected with SARS-1 and then vaccinated against SARS-2. And they isolated 6 different antibodies that could neutralize multiple coronaviruses and found that it could neutralize SARS-CoV-2 variants of concern, the original SARS, the alpha, beta, gamma, delta, Omicron, the SARS-1, and also even other animal coronaviruses. And the most powerful out of these 6 antibodies is called E7. And it seems to be targeting kind of like a weak spot in the virus's spike protein, which we know that SARS-CoV-2 uses to enter our cells. And the E7 antibody is basically kind of inactivating or blocking the process that the virus uses to get into our cells and how it shifts around to be able to get into our cells and get around our immunity. So basically, this combination of a prior SARS-1 infection and a SARS-CoV-2 vaccination turned out to elicit a very broad and a very strong antibody response that stopped basically all related coronaviruses that they tested. So this actually provides a lot of hope. This is what we are calling a pan-sarbecovirus, maybe treatment or maybe vaccine. So we've got hope for a future vaccine and a future treatment that could actually stop SARS-CoV-2 and even help to prevent the next SARS pandemic. So a pan-sarbecovirus vaccine or pan-sarbecovirus treatment would be an incredible innovation that would really change the nature of humans and SARS-CoV-2 relationship. And the next one I won't spend too much time on because it's still early. It's also a preprint, but it's hopeful nonetheless. So I hope we'll be able to talk about it again when it is finished with peer review and fully published. But basically, this study tested a nasal vaccine and found that it produced a lot of antibodies, both in the mucosa and in the blood in mice. And it also induced a powerful immune response, basically in the lungs. And so this is a vaccine that's put in the nose of mice. They found it effective both as a primary vaccine and as a booster. So this one is hopeful because we think that if we can get this kind of immunity, not only in the blood, but also in the nose, in the respiratory tract, then maybe we can have a vaccine that reduces not only severe outcomes like the current ones do, but also could reduce infection and transmission. And once again, this would really change the nature of how our relationship with SARS-CoV-2, because if we can reduce infection and transmission, then we can slow down all of these variants, and it would really change the circumstances considerably. So in summary, all indications are pointing to an increase in COVID affecting us now. Wastewater, percent positivity, emergency department visit, hospitalizations are all heading up. None of these indicators are showing a hint of slowing down or leveling off yet. And there are some important innovations on the horizon that could really change the game, like a sarbecovirus vaccine or treatment or a mucosal vaccine. But it will take political will and some real investment to bring these innovations to fruition. But still, I think there is reason to hope. And in the meantime, we should still be trying to avoid infection and reinfection. And of course, this is getting more difficult as people seem to be choosing to drop protection measures, despite the fact that COVID is still very much with us. And there is still a lot we don't know. We still have a lot to learn. We're still learning about the effects of repeat infections. We're still learning about post-COVID events and long COVID as well. What we do know is that after COVID, we are seeing an increased risk of diabetes, blood clots, heart attack, stroke, memory issues, asthma, not in everyone, but we still cannot predict who. Every infection is a new opportunity, maybe even a compounded opportunity for long COVID and post-COVID impacts. So please do what you can to avoid getting infected or reinfected and avoid spreading it to others. Let's keep up our best practices to prevent the spread of COVID and prevent outbreaks. Let's stay up to date on our vaccines. Wear a high quality filtration mask like an N95, KN95, or KF94, especially if you are indoors with others. And if you are going to be indoors, you want to make sure there's good ventilation and filtration, which is something you can assess the ventilation using a CO2 monitor, but limit your time indoors with others, limit the amount of mixing you're doing, and whenever possible, gather outside. If you're going to be having a gathering indoors, you may consider implementing pre-gathering testing as another layer of protection. And really important, if you are someone who should be treated, if you catch COVID, then you should know that in advance and you should have a treatment plan. Treatment can reduce the risk of hospitalization or death by about 80% if you start it on time. And we are still losing about 2,000 people per month in the United States alone to COVID. So it is definitely not done with us yet. Remember, starting treatment on time means testing on time, so know where you can go to get tested. And please, if you don't feel well, please stay home. If your child doesn't feel well, please keep them home from school. Please don't spread what you've got to others. And as always, remember to eat a balanced diet, incorporate fruits and vegetables and whole grains, avoid those sugary drinks, consider a multivitamin supplement. Get your blood pressure and your baseline labs checked, like sugar, cholesterol, vitamin D. Get some regular physical activity. It's pretty hot out there in a lot of parts of the country, so please be careful, hydrate. And if you are sick, please get your rest. And as always, please try to manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.